Hi. Very often in your OET speaking role play card, you will have a task which says, explain something to your patient. It could be explaining a treatment, procedure, a disease condition, or a reason for something. I'm going to teach you certain phrases that you can use every time you have to explain something to your patient. Phrase number 1, the reason for. The reason for your boil could be an ingrown hair follicle. That is, the root of the fine hair, and complete your sentence. Phrase number 2. One possible explanation is that. One possible explanation of your skin rash is that it could be sensitive to harsh chemicals like the ones you find in soaps or shampoos. Phrase number 3. What's responsible for this effect is. What's responsible for this effect is possible inflammation caused by force. For instance, if someone hits you really hard or you fall onto something, and you can complete the sentence there. Phrase number 4. Let me explain. Let's see how we can use this in an example. Let me explain this, sir. Your father's kidneys aren't functioning properly. It's unable to clear the impurities, which is why he requires dialysis thrice a week. Phrase number 5. There's no doubt that. There's no doubt that you've been able to control your diabetes with medicines and food so far. But in your case, you will require insulin injections further. Phrase number 6. It could well be that. It could well be that your body hasn't responded positively, which is why the doctor has changed your medications. Phrase number 7 is a super cool one. What I mean is that you should include a calcium rich diet, which means you should have milk, yogurt, almonds and cheese. Phrase number 8. Let me put that in another way. This can be used when you've tried explaining something to your patient, but the patient hasn't fully understood what you've just said. Let me put that in another way. You've just undergone tonsillectomy and it might take a few weeks' time until you recover fully. Phrase number 9. Let me see if I can explain myself better. Let's see how we can use this in a sentence. Let me see if I can explain myself better. You've undergone a couple of chemotherapy sessions, but the doctor has asked you to undergo a CT scan to rule out, and complete the sentence. Phrase number 10. It simply means that. This can be used in summarizing probably certain details that you've just explained to the patient. For example, it simply means that you should not be using very strong disinfectants to wipe your baby clean like the ones you've been using so far. Use very mild ones instead. So try using one of these 10 phrases that you've just learned every time your role play card says explain something to your patient. Thank you.
MedCity International Academy. Trusted hands forever.